And then the questions that lead on is, could we do better in that group, right? So that's kind of an obvious question. And then, how do we actually take what we've learned here and apply it to the majority of colorectal cancer patients? Because that's the one big frustration, is this therapy works really well, but it works really well in about 5% of metastatic colorectal cancer patients. So 95% are not MSI high, right? So how do we make headway in that kind of group? And that's a lot of ongoing work to kind of identify how to move forward. And there are some other early kind of signs that we might have some hints of approach, but that's still kind of a lot of a matter of work. In regards to this subset that I talked about, doing better for that subset, that's kind of the idea of, combination therapy. And so there's also a presentation here about the first kind of main report of combination therapy, looking at nivolumab with ipilimumab, which is an anti-CTLA-4 kind of agent, and showing that when you put two therapies together, you do have a higher kind of response rate, higher kind of PFS curve. And so it appears that this is an immune responsive cohort. If you actually do further engagement in regards to kind of trying to activate the immune system, you can have a higher benefit of activity. And so there is this idea of, should we be thinking of not just monotherapy, but maybe combination therapy. But again, that's kind of a initial publication cohort, and so we probably need further kind of data to kind of further make that a definitive statement. And right now, FDA label is for monotherapy in this subset.